case?
Yeah, I will demonstrate it's a regular case, and after that I'll be demonstrating a couple of different techniques, a small pupil and Milo, but this is a regular case. They shifted this, so I'll just finish it quickly. And again, I'm using the 3D system, which is, I like to use the RTO 3D visualization. Once you get used to it, the ergonomics is so good that you don't really feel like using the oculars. Up.
Do you think there are any limitations of the 3D system
The
or?
only limitation I find is while suturing,
Yeah.
sometimes it may be a little difficult, and then you can switch over to the binoculars, but otherwise, which is very rare. If you want to do a lot of suturing, ಸ್ವಲ್ಪ ಗದ್ದೆ ಐತಿಲ್ಲ?
You're quite right. Even I feel when you are doing the suturing of the grafts, then it gets a little clumsy because on the eye-hand coordination, etc., is better on the Oculus. But otherwise, it's a great microscope. Yes, we can
Synergy, na?
almost a grade 3, grade 2, grade 3 cataract.
Yeah, this is 59-year-old grade 2 to 3 cataract. You can see cortical spokes there, and we are implanting a 22.5 diopter synergy. So last time I demonstrated, I used the Signature Pro and demonstrated peristaltic. This time I'll be using the Venturi system. Light notarima, light nodima, light nodima. So I like to do a more of a limbal incision so that you have less astigmatism and the wound healing also is better. You may get a little ooze like you're seeing. So again, I'm aiming for a 5 millimeter axis. All these cystotomes are done with the cystotome maker, the Ganesh Grewal cystotome maker from Epsilon. That's a nice instrument. I'll show that next time, and you get very standardized cystotomes. This is the hydrodissection. You can see the posterior fluid wave, decompress, and then you can see the nucleus spins very easily.
So, Sri Ganesh, you can operate on both Venturi and peristaltic. So, when
Yes,
do you
yes.
decide which one to use, or it doesn't matter?
It doesn't really matter. See, after a particular time, the machine does not matter. Light Nodima. Okay. So I'm using 400 vacuum. So bury, and then you can see that's the chop through and through. Even in the peristaltic, when you use a very high flow rate like 60 flow rate, it kind of mimics a Venturi system. So bring it to the center, and then you can just emulsify the nucleus.
The chamber is rock solid, I think. Even when Supriya was doing that myopia case,
Yes, yes.
it was rock solid.
The chamber stability is quite good. That's the last chop, and then
I think you have finished this in exactly 2 minutes.
yeah, that's my average time for. That's the last fragment. Last fragment, you can go a little slowly, and you're more in the anterior chamber. I'm using the variable white star like Dr. Sheetal explained, so you can control with your foot pedal the off time, on and off time. As you depress the foot pedal more, the off time keeps on reducing, so you get more phaco energy. So depending upon the density of the cataract, you can decide how much of on and off time you require if it's a variable white star. This is again the Venturi IA, and then you can see that the You can very easily, this is what is called the hurricane technique. So you go around and you can completely remove the cortex.
The whole case was a hurricane case, Sri Ganesh.
So I do a little, you can see some cells there, so I do the polish, and then if you can also, so now you have a very clean capsule and bag. You can also inject the lens under BSS. See, I have not put visco,
Yeah.
so you can just do a wound assisted light nodima, light nodi. So I just injected with BSS. And that actually saves you 2 steps of putting in and removing the viscoelastic. The only thing, you have to wait for the lens to unfold. And this is the synergy, which is the continuous range of vision, CRV lenses. This is the new technology from J&J, which provides a continuous range of vision. It's a combination of the Symphony EDOF technology and the multifocal diffractive technology. You can see if the lens has not opened up completely, it shifts to one side. So you have to wait for it to open. The problem is,
I guess it is the temperature, because in Delhi, when it's cold winters, then we have this problem.
yeah,
Open up.
okay, it slowly opens up.
Yeah.
Now, does it matter where you place the haptic? I don't really think so. I mean, there's a lot of discussion as to where you should place the haptic, whether you should place it horizontally, with whether it reduces negative dysphotopsia. But in my personal experience, I don't find there to be any difference in terms of it influencing the negative dysphotopsia for the patient. So you can see this lens is very well centered, and that's the end of the surgery. Light kanatama. All right.
Thank you, Ganesh. Thank you again for that excellent demonstration of the Venturi machine.
This is a demonstration of the Venturi. So you can use either Venturi or peristaltic, depending on your preference, but both work very well on the Signature Pro.